There you go. Light up tapestry for Christmas. Hello, everyone in the internet land. I'm putting together a solstice update quickly. Wanted to show off, of course, my ugly Christmas sweater today. Trying to get the Christmas decoration in the background, but I'm seeing that they're getting washed out by the wonders of the iPhone camera. Got a tree. I'll get over there in a second and show you guys that. But just kind of a quick update. As the weekend is coming, and I'm looking forward to some rest. I'm pretty tired. Still been some short nights with sleep and having trouble getting full nights of sleep because of turns. They've got me on 3-hour turns, back in a hospital bed that's not an air bed. So that means that they have to turn me every 3 hours. And when they turn me onto my left shoulder, it's very painful still because it's pretty tender. I've been working on that for a long time. It comes and it goes. Today, it definitely is pretty tired out from a lot of wheelchair exercise this week. And lifting some weights. Been a pretty normal week. No pool this week because of the wound healing. The doctor, or Grace, says that things are going well. It's healing, but it's slow. So again, we're a little over a week out from that. But they don't seem concerned because it's not infected or anything crazy like that. So that's good. Got to keep her moving though, and keep it clean. And so they're, like I said, not gonna let me do my program for a little while. Just waiting right now actually on my tech Chris to get set up for program. So I had a few minutes. Dad's at the store. This week, let's see, Wednesday, it's been kind of sparse. Some therapists have left, like my occupational therapist Meryl Lee and Rose, both gone until after Christmas now. I've had a couple people covering this week. We went over bed management and occupational therapy, so that basically means like where to put the pillows on Mike Manhardt while he's trying to sleep so that I don't get skin sores, pressure sores basically. Then we can work up to getting rolled every 3 hours probably in the beginning, and then hopefully up to like 6 hours before I get out of here, but not sure how soft the beds are over there at the apartments yet. Dad and I are going to go look at a house tomorrow, which will be really fun. It's about 4 blocks away. It's a potential rental. The people are Craig family. They basically had the woman's husband, I think, ended up in a wheelchair. So it's accessible. They've got a lift gate to get in, and then they've got some stuff in the bathroom for accessibility, a sliding chair. So that should be fun. Potentially have the dog. So, here I am, finishing the video, back in the program chair. So yeah, getting approved for the slide transfer to the car. It's a tough transfer. Dad and I can do it though. It's just, you gotta be careful. That's one of those things where I'm still really nervous about my balance. Even being able to push down with my shoulders to lift my butt up. You gotta be careful not to tip forward and fall on your head. So, as you can see in those transfers, everybody's always kind of holding their hand on my chest because I don't have that back or ab muscle. So I can go pretty fast, and that's what happened with Rose when we were working in the PT gym once, and then it happened, I fell backwards the other day, hit my head on the bed. I don't remember what day that was, earlier this week, but Tuesday maybe? Yeah, so I was sitting on an air bed, and it's super wobbly, like I said, so I fell back, hit my head, and Peter felt awful because he wasn't holding me, but I told him, it's one of those things that I'm learning too, so I'm pretty conscious of I've got to be more conscious of when I'm losing my balance, or, where I can fall back so that I can have things padded or to be careful. That's the biggest challenge with slide transfers is balance. It's like, to be doing them yourself, you've got to be pretty confident of your hand placement so you don't fall forward and end up on the floor, because for from chair to bed would mean if nobody's there to spot me in front of me, then I'm going to the floor. So we'll keep working at it. Dad's getting the hang of how to spot, and it's pretty easy to go from chair to bed, which is nice. So that'll be saving us a lot of time with slinging, not instead of putting the sling on and lifting and hoisting, all that stuff. So kind of excited for the holiday, I guess. I'm ready for some rest. We've got a normal, probably somewhat normal schedule on Monday, but again, nobody's here. My normal therapists and doctors are gone. So it'll be an abbreviated schedule. I'll probably lift some weights and do some stretching, all that stuff. Got to stretch the legs and keep the joints limber, things like that, and then just practice putting pants and shoes on. So pretty good. Pretty chill, which will be nice. I got a few presents to wrap. Got a few thank you cards. I mean, about probably like 1,000 if you added it all up over the course of the last 3 months. So a lot of people that have touched you and helped you. 2 weeks away from discharge. A little less, actually. It's Thursday, January 3rd. We go to the apartments next door and start outpatient on the 7th of January. So I've got, like I said, I'm into the NRN occupational therapy portion, which is a very electrostim-based protocol to help me improve mobility and functionality and balance and any muscles that are firing. So triceps would be one thing I'm working on, and then, like I said, that twitchy finger, hopefully, that thumb, like when it twitches, hopefully that's turning into a muscle. But hard saying, trying to squeeze those fingers every day. I sit there and I focus on them and say, close my eyes and go. It's like that finger twitches, and then sometimes another finger will twitch, so you gotta hang on to hope, keep working on it. A lot of new people at the hospital recently. Busy time of year. Craig was, I say we, that's part of the family now. Craig was at 93 beds full, which is full capacity. Normally they like to keep it around 70 to be a little more comfortable with nursing staffs and things like that. So they have a lot of people waiting to come here right now. It's that time of year, unfortunately. People are skiing, people are driving cars, and it's slippery. People are getting hurt, getting neck injuries and brain injuries. So it's great that a place like Craig is busy, because that's good for business. But, you wish people didn't get hurt, but it happens. So my heart goes out to him. Everybody that's new in Craig this holiday, just to let them know that it's a happy place and that they're in a great spot considering circumstances, and that it's not a bad place to spend the holiday. 60 degrees and sunny today. Not just the weather, but just the Craig people. So Dad and I went out for lunch today and just sat on the patio and hoping to get out this weekend. So with the slide board transfer to the car, we're going to try to go to a movie tomorrow or Sunday and do a little last minute Christmas shopping, because that's how I do it. And then maybe go see my dog at Brandon's house. Yeah. Well, that's all. I wish everybody the happiest of holidays, and that I will keep you updated on things that go on. Like I said, when my sisters get here, it'll be a little chaotic, so the next couple of weeks might be a little sparse, but I'm going to try and do my best to keep people abreast to the transition to the apartment outpatient life. So everybody be well. Take care.